Hi, everybody. This is Deborah with Freedom Creators and a product called the Freedomwand. And we are introducing today a young lady named Bre'Anna. We've been focusing our social media and our newsletters on physical and mental health benefits that come with dignified toileting and how it improves patient outcomes for those with dementia, TBI or Alzheimer's, and those with limited range of motion with a no bending, lifting, or twisting care instruction. So we would like to welcome Bre'Anna, a certified dementia practitioner who has created her own company called Bamboo. Bre'Anna is passionate to provide dementia care knowledge, skills, and resources to dementia care patients and partners. She knows that dementia is challenging and the journey can be long and stressful. Her desire is to provide care partners everything they need to transform from caregivers into care partners and care champions with confidence, balance, and control. And we will post all of Bre'Anna's links in our newsletter that will follow. So welcome, Bre'Anna. Thank you for talking with me today.
Yeah, thank you for having me. I'm happy to be here.
Well, great. My first question is how did you come up with your name for your company, and explain a little bit about what your company stands for?
Yeah, so the name really came from like a random brainstorming session. And so it actually started with the panda. So if you see all things bamboo, you'll see a panda. And so we chose a panda just because of what it means. There's so many, symbolic things that a panda means, but one is like gentle strength. And I feel like that's kind of what you need for this caregiving journey. You need gentle strength. And there's so many, like I said, there's so many other good things about pandas. And so we're like, well, we don't want to just name the company Panda. That doesn't really make a lot of sense. And so we were thinking about acronyms based on kind of like how I think. And we came up with Bamboo because it stands for believing affection means better understanding. And so to me, what I believe is that every human is deserving of love and affection, kindness, respect, and empathy. And so it's through understanding that we're able to kind of bridge that all together. So the more that you understand about the person and their condition, both together and separately, the better care that we're going to be able to give. And so I really wanted a name that kind of reflected how I feel about that.
Oh, that's awesome. And yes, you do need to have gentle strength when you're taking care of dementia patients. I have taken care of my father for 10 months here, living in my home with dementia, and it is challenging. And it will push the best of the persons, the best of the best, to the edge.
Yes.
Yes, it does. So I have a whole new respect for caregivers that deal with dementia every day. God bless you all. Seriously. And the difficult, I've known a few people that have had their loved ones living with them for quite some time with dementia, and
it's a lot.
That's not where God gave me my best gift. So I'm so proud. I'm so proud of you, and excited that there are some of you that are just made for that gentle strength and caregiving that's needed. One of the questions that I had that is the difference that how do you describe the difference in the journey from being a partner, now that's understandable, to a caregiver, but then how do you jump from a caregiver to care champion? I'd love to hear your version of that.
Yeah, so when we think of like a caregiver, we think of someone who's just giving care. And sometimes you get caught up so much in your role of giving the care that you don't really focus as much on the partnership. It really is, it has to be two ways, because if you're just giving, you're going to empty your tank, essentially. And so if you look at the journey as more as a partnership, then you'll come out better for it. And so the champion piece of it is educating yourself about dementia. Because like I said, the more that you understand about it, I think the better that you're able to cope with it, because you'll learn not to take things so personally. You'll learn like, okay, is this normal for my partner, or is this something that I need to look into more? Is there something about the environment that I need to adjust? Because you begin to understand what's going on. And so the more education that you seek, that's where that champion level kind of comes. You're not just going through the process of caregiving. You're really taking that extra step to try to really understand what's going on so that you can give the best care to your partner.
Yeah, that's awesome. I can see where that you're more looking at things from a preventative atmosphere or a assertive atmosphere versus a reaction,
Yes.
right?
Yes.
Yeah, that's
Yes.
awesome. And that leads us into the first question. What steps or tips do you have for someone just starting the journey from partner to caregiver to care champion? So I think a lot of that was a little bit covered, but do you have anything that's like a step, like a check off list of things that you suggest people to do?
Yeah. So like I said, the first thing is getting educated. And I always recommend that people do so in the way that they learn best. So that can be through social media, that can be through books, courses, blogs, whatever. You can learn from both professionals and from other caregivers. But whatever you do, you have to take that extra step to learn more. But do it in a way that feels comfortable to you, because as caregivers, you don't have a lot of time. So if you're sitting there trying to read this long book, you're not going to get through it, and it's not going to really make a big difference for your journey. So you want to learn in the way that best meets your needs. And then the second thing is to get support early on. So don't wait until you feel the heaviness of everything weighing on you. You want to be assertive and seek support right from the beginning. And so you can do this through Facebook groups or private communities. They have in-person support groups. They even have telephone support groups. And so it's really whatever best meets your needs. And you can be a part of more than just one, but if it doesn't meet your needs, don't feel like you have to stay, because I find that sometimes caregivers join these support groups and then they feel like because they join, they have to show up, but it ends up being more draining to them than supportive. So if it's not a good fit, don't feel like you have to stay. Leave and try to find another one. You really want to try to find your tribe.
Oh, good point. Because I was in a caregiver group, and it wasn't for me. It was it just wasn't for me. I ended up having my father a couple days a week at a caregiving facility that I took him to, and that was really nice. He really enjoyed it, and I really enjoyed it, and needed the break as well. So
yeah.
Really well. Do you have any creative solutions that you found are your top 1 or 2 or 3 things that have worked really well for care partners to improve the care with their person living with dementia? A few of the basic, really best solutions.
Well, I want to share 2 stories of like thinking outside of the box, because sometimes it takes a creative out of the box solution to really get the job done, because what you'll find is even though something works one time, it may just work that one time. And so you have to continue to be creative. And so one example that I have is there was this caregiver, and the gentleman, he could do all these things, but it took him a while to process, and he was very slow and inefficient. But one thing that he had a love for was math, and he fed off of their rapport and her energy. And so she would come in there and she'd be like, okay, John, let's do some math. 2 times 2 is, and he'd say 4, like that, like no time to think, 4. She's like, okay, John, 3 times 3 is 9. Okay, John, stand up. And he would just stand up because his brain was firing. And so he could easily follow that command. Now, without that, you could tell him to stand, but it would take a long time. But with her method, I mean, he would just stand up. And she's like, okay, great. 4 times 4 is, he'd say 16. And she's like, okay, let's walk. And he would start walking. It was amazing to see. Yeah. And so it was like using somebody's history, what they have a love for, to help facilitate that. So she used that even to take him to the bathroom, to get him to sit down on the toilet and to stand back up after he was finished. And it was amazing to see.
Oh, that's cool. That's really cool. That reminds me of a book that I read by Karen Kingsbury, where one of the main roles was a gal that worked in a nursing home, and she found that you work with the dementia patient, not against them. So one was very afraid of mirrors, just petrified. So they covered the mirrors with black material. And another person just kept wanting to do this. And then they found in his history that he was a farmer and raised horses. And he was always petting the horses, rubbing down and polishing the saddle. So he
Yeah.
actually brought in a saddle, and he polished the saddle. Now, of course, it's a book, but it was my introduction to dementia was reading that book, and that never left me. So when I had my father, his best thing was singing. So then I would sit across from him when he was playing his guitar and singing, and he could follow my mouth to remember the words, because he couldn't always remember all the words. But as long as he could see me singing, he could still keep up until but that reminded me of that, and that's why I did that. That's awesome. Yeah.
Yeah. And so another example of that is I was working with this lady and her husband, and we were trying to find a way to get him to be more active, because if it was left up to him, he would just sit in the same spot all day long. He didn't really have the motivation to do much, and he also couldn't initiate it on his own. That is something that was lost. And so she told me that, before his dementia progressed, that they used to go dancing all the time. So I was like, I wonder how he would respond if you invited him to dance just in the living room. And so we turned on the music, and she invited him to dance. And sure enough, he was like, oh my gosh, like, yes. And so he got up and they started dancing. And so that's something that they started regularly doing again a couple times a week. She would just turn on the music and invite him to dance.
That's so sweet. Oh, that's really sweet.
Yeah.
So what are some things that you've witnessed that a dementia care partner will be tempted to do but shouldn't do and isn't helpful?
Yeah, so there's actually quite a few things, but the two things that come to my mind are correcting and overhelping. And so when we're talking about correcting, that can go pretty deep. But what I want to focus on is getting too caught up on truths. Oftentimes caregivers will get really focused in on, well, what they're saying, that's not true. So I need to tell them the facts of it. I need to tell them what it is, what is actually going on. But I always challenge caregivers to really think, does it matter if what they're saying is true or not? And in most cases, it doesn't matter. And so if it doesn't matter, it's much more productive to use it as an opportunity to connect and have authentic conversations about whatever their reality is, instead of trying to push against it. So that's the correction piece. And then the overhelping piece is that sometimes with helping, it can get to a point that it becomes hurtful. So there's this saying that everything that you do for someone is something that you're taking away from them. And so with overhelping, what we're really doing is taking away their opportunity to be independent and their opportunity to practice their skills. And as we know, if you don't use it, you lose it. And so it's so important to help facilitate them being active participants in their care instead of always feeling like you have to intervene. So you can do that through grading your support, whether it's just setting up the environment, whether it's just verbal cues, whether it's through just a demonstration versus actually doing it for them, or feeling like you have to put your hands on them to get them to do it.
Okay, that's interesting. I can come up with a couple of little illustrations that happened with me and my dad, but yeah, it's very interesting to keep those that clear-minded thinking when you're in the moment.
Yes.
Of them wanting to sit down when there's no chair, or go outside when it's pouring rain or something like that, right?
Yeah.
It's very hard to stay in that clear thought thinking moment.
Sure. And sometimes I urge caregivers to just see what happens if you go with it. So sometimes like you said, it's storming outside and they want to go outside. They're still capable. And a lot of times we say, don't use logic and reasoning. And the reason we say that is because we're talking about our own logic and reasoning for our reality. But oftentimes if the logic and reasoning fits their reality, it's perfectly fine. So if they want to go outside and it's storming and you're like, okay, and you open the door and they see it, they're like, yeah, never mind, because they see it for themselves. But if they don't know that it's storming outside and you're like, oh no, you can't go, it's storming, they're like, in their mind, no, it's not, right? So I want to go. But if you're like, okay, yeah, sure, but it's storming outside, and then they see it and like, oh yeah, maybe later. Like I had a lady, she was so persistent on going for a walk, and she resented her family because they would never take her for a walk. So I was like, let's go for a walk. So we get outside. She's so happy about this walk. We get outside. I mean, she doesn't even make it to the corner before she's like, no, I'm tired. We need to go back inside. But it's just something that she felt like she could do and wanted to do. But once she started doing it, her body was like, no, we need to go back inside. And so she was willing to go back inside, but it got it out of her system.
Okay. Yeah. Yeah, you just got to kind of meet them where they're at and go with it, right? Yeah. Well, because we do toileting, do you have any specific stories about ways that you can help a dementia patient in the restroom with different tools or different setups? I heard you talking about setting it up. The restroom was one of our biggest issues with my father. He did not want to sit down.
Yeah.
On the toilet. He wanted to sit down in midair, but not on the toilet.
Yeah, so there's so many things that goes into toileting because, you know, everyone has a different reason why they have challenges in the bathroom. And so it just really depends on the person. But some things that we want to think about is accessibility. We want to think about visibility. And so contrast in the bathroom is super important because a lot of times everything's white and that makes it really hard to see. And so also like in the case of your dad with like sitting down on the toilet, especially if it's a lower surface and you can't really see it, that's a lot of anxiety because someone's telling you that it's there, but you can't see it. You're going down, you can't feel it yet. And that's like, no, I don't want to do that. Also because, you know, their vestibular and proprioception, all that kind of gets a little messed up. So that's scary. But if a person is able to see it or feel it before they sit down, it makes them feel a lot more secure about it. Someone telling them usually isn't enough. And so we want to set up the environment in a way that makes it easy for them to get up and sit down. So anything like an elevated toilet seat or a bedside commode that goes over the toilet, the best product will be dependent on the person, of course. Grab bars are essential. Grab bars are good for anyone because it just adds extra support. So even if someone is scared to sit down, they feel like they have some control versus just sitting down from, midair. If they're holding on to something, they feel like they have more control. Now, as far as like the actual act of like wiping, that is where toileting aids can come in handy. So I'm not a big fan of like bidets because I just find them messy. I have not mastered a bidet, but some people love bidets and swear by it. And if they were using one prior, they tend to kind of know what to do. But me trying to educate someone with dementia on how to use a bidet, it usually just ends up being messy. Now, as far as like a toileting one, like the Freedomwand, usually that's something that I would recommend in the early stages of dementia if they're open to using it. But it becomes a little bit harder in the mid to late stages because there are a lot of steps involved and there's kind of like a learning curve. But what I've actually found is I love the Freedomwand because it's multi-purpose. So it can be used for not just toileting, but also it has that long-handled extension that's really good for bathing and shaving and things like that. And so I've found that to be really helpful because it has that little curve piece of it. And a lot of long handled devices are straight, or if they have a curve, it's just weird. And so I've actually been able to repurpose the Freedomwand in that case for bathing to help them become more independent with bathing using the Freedomwand. So even if they can't use it for toileting, it still can be used, which is great.
You just said something that came because I'm an inventor, right? And it's like, well, everything is white and they do lose their ability to see color and depth. So do most dementia patients become a bit colorblind? Now, my dad was a little bit colorblind in the first place, or he didn't know how to match things. But I was thinking, why has nobody really created a toilet seat or the grab bars or the railings that are a color that dementia patients, for the most part, can see? Which I don't know. I've never studied that. But what is a color that stands out the longest for those that you lose their ability to see color? I would assume it's red, but I don't know if that's true.
Yeah, so it's not really so much a color blindness thing as it is like decreased contrast sensitivity. And so that's basically when similar colors, you can't really distinguish the foreground from the background. So everything just kind of looks the same. And so really what we find is that the color is less important than the contrast, whatever that object is standing out from whatever it's against. And so from a scientific perspective, they've done studies and lime green seemed to be the color that stood out the most to people. But but when they did like more broad studies with just color in general, they found that it really didn't matter what the color was as long as it was able to catch their visual attention and it stood out from whatever it was up against. So it could be red, it could be blue, it could be lime green or green. It depends on whatever it's against.
They really should have the railings of the toilet seat stands a different color from their background, and the toilet seat itself should be a different color from the background so they can see the variation. That's very interesting. That would maybe have helped my dad, because boy, that is why he went into nursing home, because he sprained my wrist with his anger of me not being willing to sit down, but wanted to sit down in the middle of the floor. And the second time he did it, it took 3 of us to get him up, and that was the end. I couldn't, he fought against us. He used his muscles against us. So instead of working with us when we were trying to pull him up, he would pull us down. So he was using his muscles opposite what he needed to use them for. So it got to be but well, I think we've covered everything. Do you have anything else that you wanted to quick add or talk about that had come to your mind that we haven't covered yet?
Yeah, so I will say like the best care is always going to be person-centered care. So if you ever find yourself struggling with any care need for your partner, whether it's toileting needs or something else, I highly recommend that you ask your partner's doctor for a referral to occupational therapy so that we can actually come in the home and see what the issue is. And then we can provide a personalized approach, because it's so much easier when we can see it for ourselves, to see what's actually happening so that we can give you a recommendation that you can try, give us feedback on, and we can adjust if we need to, versus like you can go on social media. There's so many tips. You can try them and you'll find that sometimes it just doesn't work. And it might be because it's not addressing the specific need that your person needs. So.
And how can anybody, if they have any further questions, can you share your contact information with us? And we'll have that in our notes, but if you want to share where you're located and how they can reach you, that would be great.
Yeah, so hello@letsbamboo.com is my email, and bamboo is BAMBU. And then you can also find us on social media. Instagram is where I'm most active at Let's Bamboo. And then our website is letsbamboo.com.
Okay, awesome. Well, Bre'Anna, thank you so much for taking the time to help us understand a little bit more. And I found it was a fascinating conversation. So I appreciate that very much. And thank you for your time, and have a wonderful 2023. We're just all praying it's going to be a whole lot better than 21 and 22.
Yes, you too.
All right. Have a great day.
All right. Bye-bye.
Bye.